All right, today in radiology, we're going to be looking at the different types of instruments that you might see in a dental office when you get ready to take x-rays. These are different types of RIN instruments or just regular XCP instruments that we'll be using here in our dental office, and then some other things that we don't use here but that you may see out there in a different office, and we'd like you to at least be familiar with them. So Ms. Gonzalez was going to be helping me. She'll be pointing out what it is, okay? The first ones are going to be our basic white RIN instruments, okay? And these are our RIN. That the Ms. Gonzalez is going to hold up is the ring, okay? Also, the next part is going to be the bite stabe, okay? The ones that Ms. Gonzalez is holding are going to be used for posterior x-rays, okay, which include both the crown and the apex when you take the x-rays. The rods, aiming device there, are the ones that you use for that. In a later video, we'll show you how to put them together and things like that, okay. The next one that we're going to move over to is going to be for your bite wings, okay. Again, we have the bite wing ring, okay. Then we have the bite stabe that you use for bite wings, right. And then we have the rod, bite wing rod, okay. The next one over is going to be our anterior. Again, that's the ring. And you'll notice that the ring for the bite wing and the anterior are both the same, okay? The bite stabe for the anterior, and then the anterior rod. Almost looks like the posterior, but it's a little different. And again, we'll talk about that after, okay? The next ones that we're going to be showing you are going to be same kind of x-ray. They're still RIN instruments. They are color-coded though. Okay. Here in the program, we always start off with our white RIN instruments, and then we lead into the color-coded RIN instruments. It's almost like I give the example of learning how to tie your shoe. You know, you learn how to tie your shoe, or you can Velcro your shoes. Well, the first way, everyone really should learn how to tie a shoe, and then the easy one, the Velcro, comes after. So basically, you learn with the white, and then you can separate and color code RIN instruments. Okay. Again, this is going to be your posterior ring, and then your posterior bite stabe, and then your posterior rod. Notice that the tips are yellow to correspond with the yellow ring and the yellow bite stabe. So again, a lot of the students like that, but we always start off with the white ones so that you actually learn how to put them together beforehand. And then again, not all offices might have color-coded RIN instruments, so it's good to learn the basic ones. Okay. The next one is going to be your anterior color-coded. Of course, it's blue. That's the ring. Then the bite stabe, and then you have your bite stabe, your rod for the anterior with the blue little teeth to match the ring and the bite stabe. Next one over is going to be your bite wing. These are red, that's the ring. Then we have the bite stabe, it's red. And Ms. Gonzalez has two there. In a minute I'll just show you what's the difference in that. The next part is the rod, and you can see it's red. Okay, now what I'm going to do is I'm going to give Ms. Gonzalez some film. Okay, The reason why there's two is because there's a horizontal one and then there's a vertical one, all right? So basically the most common that you would see in a dental office would be the horizontal, okay? Then you also have vertical ones. Those are used mainly when you need to go down a little further and see if there's any periodontal disease, okay? When there's regression in the gums and the doctor wants to keep track of how it's looking, so they'll use those, okay? All right. Next, what we're going to show you, it's one of the newer instruments out there. It's RIN XCP, and it's the Aura, and it's called the one ring alignment, or excuse me, one ring arm, okay? It's a kind of a combination of what we just showed you, except it's all in one. So you have the one rod, if we can see the rod first, Ms. Gonzalez, if you can point out the colors on the rod, you can see that there's the blue, the yellow, the other side has the red. And then if we can look at the ring next, you'll see that there's the blue, the red, and the yellow. Now Ms. Gonzalez has the red part of the ring attached to the rod. So that means she has to put on the bite ring bite stave and just readjust the ring, Ms. Gonzalez, so it's on the opposite side. Okay? There you go. Now, as you can see, she flipped it. Same color, red, red, and red. Okay, she puts it on, and there you go. It's the one ring arm, okay? And then you just choose the color and you place it, all right? The next one over that we're gonna show you is, it's an older model, but it's coming around again. You know how things just go out of style and then they come back. This is called a unibite. And the reason why is because it's all in one, okay? Advantages of the unibite are that you can place the film in there and you can take your bite wings, your anterior, your posterior, all in one with that one particular instrument there. However, the disadvantage is that it's plastic, okay? And if you don't mind, yes, moving those a little bit for me. Lots of times, because it's plastic, when you place that in the mouth, if a patient is moving around and stuff, if it's, you know, they're feeling a lot of discomfort with it, it'll move on you. So if you have it set for a bite wing, it may automatically switch to a posterior setup, okay? So that's the disadvantage of it, right? The next one here is also by RIN, and it's a flip ray. And notice that it is pink, okay? The pink is used for the anterior and the bite wings, okay? So it's kind of that, almost the same concept as the unibite, okay? Except you can't do all of them, okay? You slide it in between the two plastics, okay? And then you flip the ring. You can flip the ring, you can flip the bite stave. So advantage of this, again, is it's all in one. You can do bite wings and anterior. However, disadvantage to this is it can be quite confusing. It can be quite confusing as far as turning it, switching the ring, the bite stave. Again, it's plastic, so after a while, the wear and tear on the plastic, you know, you have to replace those, okay? The next one over is also by RIN, and it's a flip array, okay? And it is for anterior, both bite wings, vertical and horizontal, okay? And again, same concept. you can flip the bite stave to do vertical and horizontal. Okay, and then you just have to switch the ring. Disadvantage would be the same. It's plastic. It has a tendency to wear and tear after a while. Okay? Thank you. One of the next things we're going to show you are, let me just focus in on this a little bit more, is the snap array. Okay? A snap array you'll see a lot of offices. Okay? Some people love the snap array, some people just hate it. So you'll have to figure out where you fall in between there. The snap array can be used to take both anterior bite wings, posterior, vertical, horizontal bite wings, okay? And again, we'll talk about and show you how to do that. The next thing that Ms. Gonzalez is holding up is a disposable bite stave for anterior. You can also use it for posterior. The nice thing about it is it's disposable, so you can throw it away. Everything else that we've shown you up to now has been autoclavable, so you don't want to throw that away. So, you know, you want to make sure, and we'll talk about sterilization and stuff. So, Ms. Gonzalez, do you mind moving that little bite stave out just a little bit? Thank you. Okay. The next part that we're going to show you here are some of the accessories that we'll be using in the spring that we have. And basically, these are like little cushies. Lots of times patients will complain of discomfort that they feel, whether it be at the bottom or sometimes the top, but mainly at the bottom because that's where the tongue is and they feel the sensitivity when it digs in a little bit. So the companies have invented these little cushies almost to serve as protection from the edges, okay? So that's one form. One that's very popular here at our dental suite that we do use is the foam flap, okay? And that is just a little foam and you place it right where you need it, whether it be in the middle, off to the, you know, for bite wings or for anterior or posterior. Nice thing about those is that it's made out of foam, so if you keep it in the mouth, it won't absorb the saliva, okay? The next ones that we also have here are the bite tabs, okay? Bite tabs are the same concept. You can, you know, they're disposable, gives you little directions on, you know, peel and press kind of thing. Nice thing about this, again, is lots of times when you use the temp tabs, the bite tabs or the foam flaps, it is easier for the patient rather than having the, feeling the edge at the bottom, okay? So disadvantage of that would be that it's made out of paper, so it will absorb the saliva and have a tendency to absorb the saliva and deform, so it may just move on you. Okay? So, but you know, if you take it fast, it shouldn't have that. The next one that we're showing you here is another form of a cushy, just kind of like these blue ones that we just showed you over here. These are like those little noodles that you have, that you would see like in a swimming pool, okay? Those long noodles that you use when swimming. Nice thing about this is that there's a little slit and you just slide the film right in between there and then you just use it, okay? The other ones that we showed you before are like those little pockets, you just slide the film in. Then the other one in the bag is the kind that you actually stick on, okay? Last but not least, one of the things we want to show you, and this just has to do with infection control, and we'll be talking a lot about infection control. These are two films that Ms. Gonzalez is holding. One's in a plastic barrier and one's just plain with no barrier, okay? Nice thing about that is that, of course, it's already wrapped for you. It has to do a lot with infection control. Whether your office uses plastic barriers or not, we really don't use them as much. but we sure do stress infection control when handling films and a processor. Okay? Thank you.